On today's show, flu season has begun, and this year the continuing coronavirus pandemic will complicate the picture. COVID 19 and the flu are both contagious respiratory illnesses. You may be wondering, if you get sick, what should you do? How important is it to get your flu shot this year? Will the flu season be bad this year? We have three expert physicians from Kaiser Permanente here to discuss the answers to these questions and much more. I'm your Fulton County Commissioner, Natalie Hall, and the district is next. Since 2010, the Centers for Disease Control and Prevention estimates that the flu has resulted in 9 million to 45 million illnesses a year, with roughly 39 million sick with flu last year. Healthcare forecasters are determining the issue of the flu and COVID-19 to be a twindemic. The flu and COVID-19 share the same symptoms and both attack the respiratory system. As a result, Kaiser Permanente has launched a flu vaccine awareness campaign to impress upon citizens the importance of getting a vaccination during a pandemic, as well as address the myths about the flu vaccination. Recently, Kaiser has assembled a team of experts to assist in communicating to the general public the evidence-based science of the flu and the efforts of vaccination to reduce the flu infection rates. Today, we have three of those expert physicians, Dr. Pimentel, Dr. Griffith, and Dr. Lobilo of Kaiser Permanente, who will be joining us to discuss how we can reduce our chances of getting the flu as well as COVID-19. First up, Dr. Pimentel, welcome to the show.
Thank you so much for having us, Commissioner Hall.
Dr. Pimentel, thank you so much for being with us today. You currently serve as the Physician Program Director in the Quality Performance and Population Health Department for Kaiser. Can you tell us what myths do we need to dispel about receiving the flu vaccine?
Absolutely, one of my favorite topics to talk about. The most common one is thinking that the flu vaccine will make you sick. That's what we hear all the time, and they themselves have had it before and they felt sick, or they know somebody. But actually, the flu vaccine doesn't have a live virus in it. And the nasal spray actually has a weakened virus. So it actually cannot replicate inside of your body. And it does give you some side effects or symptoms of, like, you may feel a little bit achy, you may have a little bit of temperature, a sore throat, little sniffles, and that's it. That usually comes on within a couple of hours and lasts about a day. Your arm will be sore, but it's nothing compared to how bad it is having the flu illness. And some other things, like, people think about, they're healthy, they don't need it, they don't think the flu is serious, or they can just take some natural remedies to help themselves. But actually the flu can be very serious, and it kills thousands of people, as you already mentioned, every year. And the effectiveness of the vaccine has been shown, actually, where 71% of people actually is decreased hospitalization for seniors when they do have the vaccine as compared to not having the vaccine. It's also shown that children, especially less than 5 years old, 51% of them have reduced likelihood of death when they take the flu vaccine. So it's definitely serious and it's definitely effective. The other thing I want to say, people don't think it's safe. Millions of people have taken the flu vaccine and it's definitely safe. And we have, like, nobody dies from it and there's no serious effects from it. They've done this research. So people can trust that it's safe. I get it every year. I've been getting it for 25 years.
When is the best time of year to receive the flu shot? And do the effects of the flu shot wear off?
Absolutely. That is a really good question, Commissioner Hall. So the time to get it is in the fall. That is the best time to get it so you can get protected. It takes about 2 weeks to actually give you protection. And the vaccine, actually, it does wear off as time goes on. about 6 months to 9 months. Some people will have it longer. That's one of the reasons why we have to have the flu vaccine every year, in addition that the strains may change.
Well, who do you recommend should receive the flu vaccination?
Everyone 6 months and older should get the flu vaccine, but especially those who have chronic conditions like diabetes and asthma, heart disease, kidney disease. Those who are 65 and older, 70 to 90% of the deaths occur in people who are 65 and older, so it's really important. Pregnant patients should definitely get the flu vaccine. They are at least 4 times at higher risk of getting hospitalized and getting sicker. So definitely any trimester, they can get the vaccine. And the little kids, it's really a shame when the babies die from flu, and something that can be prevented, especially those that are less than 5 and also those that are less than 2. And you can't get it till you're 6 months. So you definitely want to have everybody who are around these folks to actually get vaccinated to be able to protect the baby and your family and your loved ones.
Well, what are other lifestyle changes that we should employ to stay well during this flu season?
Yeah, so some things that you should do are basic lifestyle changes that we have been saying for I don't know how many years. You want to do the eating right, so lots of fruits and veggies. Also, you want to exercise on a regular basis, 30 minutes a day. You don't have to go to the gym, just walking, 30 minutes a day. You also want to take some time to kind of de-stress and do some meditation or some prayer. That will help, because when you're stressed out, your immunity is decreased. So there's a really thing. And don't forget sleep. Sleep is very important, 7 to 8 hours. Don't underestimate the value of sleep.
Let's take a break. When we come back, we'll speak with Dr. Labilo and Dr. Griffith, who will discuss some of the disparities we see in flu vaccinations. Please stay with us. Welcome back. We've been talking with medical health experts from Kaiser. Dr. Labello and Dr. Griffith are here to share some vital statistics with us. Dr. Labello, you serve as the Physician Program Director for Epidemiology. Please share the statistics surrounding African Americans versus white citizens receiving the flu vaccinations. Why is there such a disparity gap?
Yes, thanks, Commissioner Hall. We've known that there are disparities in vaccination. In the US, overall, over the last 10 years, about half of the population received the flu vaccine. In Georgia, it's a little bit less, around 45% of adults and individuals that should receive vaccination do. But unfortunately, that percentage is lower when you compare white versus African Americans. African Americans have about 6 to 8% lower vaccination rate compared to whites. And we also see similar trends for Latinos. So we clearly put a lot of emphasis on educating the public on the importance of flu vaccine and also to close those racial disparities, because clearly prevention is the most important thing we can do to lower those bad statistics about the flu. Why do these disparities happen? There are a number of reasons. Some populations may have less access to healthcare, or may have some misconceptions, like Dr. Pimentel said, about the effectiveness of the flu vaccine, its safety. But also there are real implications of some things that have happened and that have affected the African American community in the past. For example, the Tuskegee experiments in the 1930s, 40s, and 50s really eroded the confidence of African Americans with public health interventions, and we're still battling the effects of those missteps. So this is why it's so important to really talk about the existence of these disparities and to address them. So we at Kaiser Permanente, keep track of these numbers and do a lot of work to really lower those disparities.
Well, that leads me to my next question. So why should African Americans consider getting their flu shot?
Yes, and then, there's a lot of statistics that we hear, a lot of reasons. When I try to explain this is, one of the sort of messages that seems to resonate is that you don't only take the flu shot to protect yourself, but you also do it to protect others around you, persons that you love, that may be vulnerable to the effect of flu, or that may not be able to be vaccinated because they are lower than 6 months, or because they have chronic diseases like cancer, for example, or other diseases that affect their immune system and therefore make them unable to receive the flu shot. So if your household is all vaccinated, you are in effect protecting that family member that is vulnerable. But of course, there's a number of reasons why you should personally receive the flu shot. It lowers your risk, of course, of severe flu, but it also, it's important if you have, for example, heart disease, because it can lower the rates of heart attack. Flu can actually trigger a heart attack. If you have diabetes, you have a much higher risk of hospitalization and getting into the ICU because of the flu. So it's very important for you to receive the flu shot. Pretty much all chronic diseases, including, for example, excess weight, obesity, is a risk factor. So you should really protect yourself by having the flu shot, which is the #1 thing that we can do during the flu season to protect ourselves and the community.
Well, Dr. Lobello, what is the difference between COVID-19 and the flu, and should we be concerned about one more than the other one?
I think we should be concerned about both. The issue, of course, with COVID is we don't have a vaccine yet that can help us protect. And that's why it's so important to really take advantage of the one vaccine that we do have available, which is the vaccine for flu. When you think about the symptoms, of course, there is going to be some overlap between both diseases. For coronavirus, we are really more worried with fever, cough, and particularly shortness of breath, chest pain. Whereas with flu, you may have fever, you cough, you may also have some muscle aches, but you typically see more congestion and sore throat, and not necessarily that shortness of breath. That shortness of breath is really the key factor that sort of makes us worry about COVID, and that should prompt individuals to go to the emergency department if they really have difficulty breathing and they feel like they're not able to oxygenate very well. And of course, we also have other symptoms that are more related to allergies, like sneezing, like itchy nose, pretty eyes. So there's some overlap, but I think it's important to try to differentiate, and also making sure that you're protecting yourself with the flu shot, and also with social distancing and with the masks for both coronavirus and flu. We are hoping that if more individuals are wearing masks regularly, not only they're going to protect themselves against this new coronavirus, but it will also help us have a low rate of flu this year.
Thank you so much, Dr. Lobello. And Dr. Griffith, you are a child, adolescent, and adult psychiatrist. Can you help us understand the apprehension regarding the flu vaccines in relation to African Americans?
Well, Commissioner, that is a great question. And so first of all, just want to thank you for hosting this forum for our community and allowing us in Kaiser Permanente to be a part, protecting the community that we live in and love. So in regards to that question, our first thing I want to do is make sure that we don't vilify or label our folks as being ignorant for not accepting this flu shot. And there are historical perspectives behind this. So, one of the things is Dr. Lobello just referenced, that fewer than half of African Americans receive flu shots. And in some communities, it may be only 25 to 30%. So with these historical perspectives, when we think about research, clinical trials, over the past 25 years, there have been major changes in the ways that clinical trials are conducted to ensure their safety, consent, and transparency. But we know it has not always been that way, which can be some of the reasons why African Americans are hesitant to participate in research, receive experimental treatments, or even proven treatments like the flu vaccine. It's like our collective memories and experiences of being, lab rats or guinea pigs. And so there's been this history of fraudulent research that's harmed Black communities that contributes to this lack of acceptance. So Dr. Lobello just mentioned the Tuskegee experiment. So a little more details about that. We all know a little bit about this. Just happened just down the road from here. But for more than 40 years, beginning in 1930s, 400 African-American men in Alabama, they were poor, they were Black, and they were denied medical care in order to examine the long-term effects of syphilis. They were told they were being treated, but actually they were given placebos. And the placebo treatment continued 30 years, even after penicillin became available. This study was sponsored by the US Public Health Services and the National Institutes of Health. They sponsored the experiment. And in 1997, President Clinton and our own Dr. David Satcher, who was Surgeon General at that time and professor at Morehouse School of Medicine, he was at President Clinton's side when the president issued a public apology about this. And it goes on and on. There have been multiple events where poor Black people, prisoners in state and federal correctional facilities, have been the recipients of experiments without their knowledge, harmed. And so it is this kind of historical information that has led to our fear about receiving, vaccinations and treatments and participating in clinical trials. When you look at the current COVID vaccine, part of the problem they're having right now is recruiting enough minority participants for the COVID vaccine trial.
One of the areas that is least spoken about when it comes to the pandemic is the mental and emotional toll that it can have on the community. Please speak to us about the psychological impact COVID-19 and the flu twindemic is having on the community.
All right. So, as you mentioned that term, twindemic, if it was just that simple, if it was just this virus that we're experiencing, what makes this even more challenging now is there are two or more viruses being exposed to. So we have this twindemic that's happening at one side, and then at the same time, we've had this explosion of racism just being seen in our faces. When you look at what happened to George Floyd, Ahmaud Arbery, Breonna Taylor, and Rayshard Brooks, and you mix that with this virus that, I've been out of medical school now for more than 30 years. We never learned anything about anything like this. I mean, what kind of virus is it that you hug your mother or you shake somebody's hand, the next week you've got a cough, the following week you could be on a ventilator, and then after that you could be dead. So we are in very, very challenging times. And between the COVID, social unrest, social injustice, it's just a bit much to handle. And so there are certain things that we can perhaps do to help us to get through this. The first thing is don't give in to temptation. So right now, if you go outside, you go to the grocery store, gas station, you'll see people walking around as if nothing's happening. No mask. You got to protect yourself. You got to protect your family. You got to protect those that you love. So it's sort of like being in a hurricane and you're in the eye of the storm, but you know that backside of that storm can be potentially more damaging than the front side. So there's some real good, helpful tips that you can do. We are all social creatures, social animals. So spend time talking to your loved ones at a distance. The pandemic happened in 1919, 1920, but they didn't have a telephone back then. They didn't have Zoom. They didn't have Skype. They didn't have Twitter and Instagram and all that stuff. So connect to your people, your loved ones, your family, your friends in safe ways. Use nature as a way to help you through this. Go outside, take a walk, pray, meditate. As Dr. Pimentel said, exercise, get in shape. If you get better sleep, you get better exercise, and you come down with one of these viruses, you can be in better shape to fight it off. Cut back your use of alcohol, drugs, cigarettes. All those things affect your respiratory system. And if you get one of these potentially deadly diseases, it's going to take you down. In terms of getting mental health and mental health support, if you work for a government agency, or you work for someone like us at Kaiser, we have an EAP service. You can call and get help from your EAP, and many times they'll give you 8 to 10 sessions just to have someone to talk about. If you don't have any insurance, and so that's where this virus and these health problems affect our community disproportionately, because many times in African American underserved communities, they're less likely to have health insurance. They're less likely to have access to healthcare services. And then the mental health services often carry a stigma. So we want to make sure that you try to find some services to help. Fulton County has a very good community mental health system. Reach out to your Fulton County Health Department, your health agency, and see about getting some help, mental health services for yourself.
Dr. Griffith, what practices do we employ to change a no to a yes for those that remain skeptical about receiving the vaccination?
So this is a part of it right now. Engaging in your community, encouraging our members in the community to take a vaccine requires building trust. Coming from community leaders, your doctor, your pastor, your family, your friends. So it has to be from people that you know, love, and trust, rather than just listening or reading a government public service announcement. Often these public service announcements just say, you need to do this, but it has to come from within, because again, that legacy of mistrust about vaccines and about what's being told to you, it does have a historical perspective. So it takes people who live where you are to help you break this cycle.
Thank you so much, Dr. Pimentel, Dr. Griffith, and Dr. Lobello. We appreciate this information. We need it so much more than ever before, since we have now we're dealing with COVID-19. So during this time, we all need to be informed on the best ways to protect ourselves and our loved ones. The important thing to remember is that we have a choice. Epidemics like earthquakes, tornadoes, and floods are part of the natural cycle of life on planet Earth. The question is, how will we respond? On today's show, we presented valuable information so that you can respond to the challenges we are facing today and make the best decision for you and your family. That's our show for today, and a special thanks to our guests for joining us, and a special thanks to you for watching The District. Feel free to contact our District 4 office anytime by calling 404-612-8226 or emailing at district4@fultoncountyga.gov. And be sure to connect with us at FullCoD4 on Instagram, Facebook, and Twitter. Until we meet again, I'm your District 4 Fulton County Commissioner, Natalie Hall.